Today is August 27th and it's a Saturday. Sorry, I've been kind of MIA. My online master's program for speech and language pathology started last week. Although technically it doesn't the classes don't actually start until Tuesday of next week, so in a few days, but we had to do a sort of orientation boot camp where we had to have a couple of meetings with the different faculty, do some activities and academic advising and whatnot. So it really kind of feels like it already started, although they don't want to count this time as uh, exactly class time just yet. I did not take my stimulant medication, the mydayis and the Trintellix, for like the past 2 days because I have been going to sleep late, waking up late, the usual. And I've mentioned this before. I just don't like to take the stimulants too late in the day because then it keeps me up. But one of the things I really dislike about stimulant medication for ADHD versus non-stimulant medication, because I've tried both, right? I've tried Strattera, Wellbutrin, Ritalin, and now I'm on mydayis, which is a stimulant medication, is that if you don't take it for like a day, you really, really feel it. I mean, it drains your energy. You feel like your energy is drained, like you can just sleep all day long, like you really have no energy, no motivation. You're just drowsy, tired, lethargic, and that's how I felt all day yesterday because I didn't take the my little stimulant pill in the morning, which was the mydayis, and I felt really, really horrible, right? Not necessarily depressed, but just like I had no energy whatsoever, not even to move or to walk. I just wanted to sleep all day long. Hell, like that's how exhausted and lethargic I kind of felt. But with the non-stimulant medication, which is the Wellbutrin and the Strattera, which I've tried in the past, uh, it doesn't take effect right away. So I'm not sure exactly how it works, but I know that there are two different types of medication for ADHD, and I know that the non-stimulant usually takes a couple of weeks for it to build up in your system and for you to start feeling the effects, kind of like the antidepressant. Whereas the stimulant medication, you'll feel it almost immediately within like a half hour of taking the medication. And so for the non-stimulant medication, like the Strattera and the Wellbutrin, if I didn't take it for a day or two, the effects were not that extreme. I wasn't exhausted or lethargic. I still had kind of energy to do some of the things that I had to do. So that is one of the biggest contrasts and the biggest cons, I think, to taking stimulant medication is that the effects are immediate, but if you forget to take it or just don't take it for one day, um, the side effects are immediate. Also, you will definitely feel it. You will definitely feel that lack of energy. You will definitely feel like exhausted, tired, drained. And that's something I really, really dislike about the stimulant medication, but it is what it is, right? But anyway, I was talking about how I started my graduate program already, and I'm just so tired. My office is a mess. My room is a mess again. It just feels like it's a cycle that repeats over and over again. Like I go through periods where I'll keep my room clean for like a month or two, and then go back down to another period of time where my room will be a complete mess for months at a time. And I wish that I could stay consistent with the cleaning and just if I could at least have a clean space to come to and to kind of to be in, whether it's my office or my room upstairs, but that is clearly not the case. At the time, I really have to clean both my office and my room. Both of them are like a pigsty. They are an absolute mess. And I don't like living that way, and I think it bothers me even more that my son has to live in the mess that I created and that I just don't have the energy and the motivation to really clean up. And I don't want him to think that it's a normal way of living. I want him to be more organized and more clean than I am. There's a chance that he may also have ADHD. He definitely struggles with mood regulation, and that's something that I've wanted to kind of look into. He's only 8, but he's very much like me. He's very sensitive, he's very much an empath. He's very caring, but he's also has this really kind of high and low mood swings that he struggles with. So that could be ADHD related, or his dad does have bipolar disorder, so it could be also a mood disorder. But anyway, I came on here to talk about something and I can't even remember exactly what it is. Um, let's see. Talked about the graduate program, the effects of the stimulant medication when you don't take it. I don't know. I guess that's it for now because I can't even remember what I came on here to talk about. But um, just a short update for you guys in case you guys were wondering where I've been or not. In case you guys have questions or anything about taking mydayis, I'm currently on 20 milligrams. Oh, another thing I wanted to mention. Recently, I went from 12.5 milligrams of mydayis to 20 milligrams. My provider increased it, and I initially thought that I was feeling nauseous because I wasn't taking the medication with breakfast, but I started taking it with breakfast and the nausea is still there. So I think I may have to go back down to the 12.5 milligrams, and I hate that I'm so sensitive to medication. I wish I could find a medication that doesn't make me feel sick or nauseous or give me a rash or all of these other side effects that I've experienced. But apparently, I'm ultra sensitive and I have to stick to low doses. So I may have to talk to my provider about bringing the dose back to 12.5 from the 20 milligrams that I'm currently taking. Also, I finally got to speak to a neurologist. So, for those of you who don't know, I have inattentive ADHD, major depressive disorder, cerebral palsy, and generalized anxiety disorder. And one of the side effects of, I think, cerebral palsy is that I tend to startle very easily. It's called the moro reflex. So, like a startle reflex that we're supposed to lose shortly after birth. But I think that because of the brain damage caused by the cerebral palsy, I think that we tend to retain that reflex, and I become very, very easily startled. I think it might also have something to do with the fact that my muscles are very kind of stiff and spastic. I experience a lot of spasticity due to the cerebral palsy. And I've been wanting to go in to talk to a neurologist because they're kind of the experts when it comes to all of the things and disorders of the brain, right? But my insurance just wouldn't cover it. So then eventually I got back on my son's dad's insurance, and I was eventually able to see a neurologist last week and kind of explain to him the symptoms and the fact that I've also been having migraines and nausea, but that mostly happens when I'm stressed. Um, and so I went in and he asked me if I've had seizures because it tends to happen. Not everybody with cerebral palsy has seizures, but some people do. I told them when I was younger, my parents said that I did have a seizure or two, but they weren't very common, and I'm not aware um, of it being more than just a couple when I was younger. And uh, as far as I can remember, in my childhood and my adult life, I didn't have any seizures because those other seizures that happened when I was younger, I was like an infant and a toddler, and I don't remember them. But I did tell him that I also struggle with depth perception, and I have a terrible sense of direction, so I get lost everywhere I go. I constantly feel disoriented. And he asked me if I tend to space out a lot, like if I'll be sitting there and just be looking out into space, and people tell me that I'm like spacing out, and that does happen quite a bit. And he said, you may be having mini seizures. I'm not saying that you are, but it's something that I want to rule out because I guess seizures can look differently. And these types of seizures that he's talking about, they're kind of hard to recognize because they don't look like what you would typically think of someone having a seizure. It could just look for like someone spacing out for like 30 seconds, and that's about it. And so he did an MRI, which, by the way, if you don't know what it is, it's like when they take a scan or x-ray of your brain, but you have to go in through the MRI machine, and I'm a little bit claustrophobic, and it makes a lot of loud noises while you're in there, and I hate loud noises because I become very easily startled, as I mentioned previously. So I thought that I was going to have a really hard time with the MRI, and it was a little scary, but I made it through and I did okay. And then he's also going to order an EEG, which is where they hook up the little cables and stuff to your brain to look at your brain waves. And I guess that's how they determine whether or not you've had or are having seizures. And so I'm going to get that done next month. And also, I mentioned to him about like the constant startling and whatnot, and that I've read online that baclofen, which is a muscle relaxant, uh, could help with that because it helps relax your muscles. And of course, us people with cerebral palsy have very spastic and very tense muscles. He said we would kind of discuss that after he got the results of the MRI and the EEG back. That right now he really wants to focus on the migraines and the nausea, and making sure that I'm not having any mini seizures. So I'm hoping he was pretty understanding. So I'm hoping that he will eventually prescribe the baclofen, which will help relax my muscles, and in turn, um, that will help lessen some of my startle reflex and me being constantly startled and on edge. I even read online that baclofen is even used as an antidepressant for by some people, and if that's the case, then I may have to talk to my psychiatrist and see if I have to come off the Trintellix, or how the baclofen is going to interact with the Trintellix, which I'm already taking, which is technically, which is also an antidepressant, or if that it's gonna interact with my mydayis, which is the stimulant, and if I have to come off of any of those other medications, because I really want to give the baclofen a try for the muscle relaxing, and who knows, it might help with the depression as well, so I might end up killing two birds with one stone. But knowing how sensitive I usually am to medication, I'm just trying not to get my hopes up. So that is my update for now, and I will be back.